Hi, I'm Dr. Jeff Stout, and welcome back to Ask a Chiropractor. One of the questions that we get asked often is, what's the difference between adjustments by hand or an instrument adjustment? And to understand that, first of all, you have to understand that the chiropractic word, the chiropractic profession, chiro comes from a Greek word meaning done by hand, and praxis comes from the Greek word meaning to practice. So it literally means to practice by hand. However, in 1967, there was an instrument introduced called the activator, and then a few years later, in 1990, there were two other instruments called the Pulse Star and the Pro Adjuster. And these instruments used mechanical means to do adjustments similar to an adjustment by hand. There have been studies that have been done since then. In 2010, there was a study done by the National Institute of Health that showed adjustments done manually had better range of motion and had greater pain relief than an instrument adjustment. However, in 2012, a study done by the Canadian Chiropractic Association showed that for lower back pain, they were very similar in their results. And in 2016, for neck pain, manual adjustments or adjustments done by hand were found to result in better pain relief and better range of motion. At Stout Chiropractic Clinic, we utilize individual care programs and care techniques that in each patient's situation we feel will work best. The science of what we do is to analyze and define the subluxation present, but the art is to decide which technique works best. The majority of the time we will use manual adjustments or done by hand. However, there are instances with certain patients, maybe if they have issues where they don't tolerate or do not like the manual adjustments as well, we will utilize instruments as well. So thanks for your question, and keep sending those questions, and remember to look for another Ask a Chiropractor video.